Cystic fibrosis, otherwise known as CF, is one of the most common inherited genetic disorders in the world, affecting 80,000 people globally. To begin our discussion of cystic fibrosis and its treatments, we have brought in Dr. Sean Aaron from the Ottawa Hospital's Department of Respiratory Medicine.
Until a few years ago, cystic fibrosis would kill our patients in young adulthood or middle age. They would die of respiratory failure. They would develop severe bronchiectasis and airflow obstruction, chronic airway infections.
CF is inherited via an autosomal recessive pattern, meaning both parents must have at least one copy of the defective gene to produce a child with CF. In Canada, roughly 1 in 25 people are carriers, making it one of the most common disorders in the world.
The most common disease-causing mutation in CF is the 508del, which means that the 508th amino acid phenylalanine will be removed from the protein. This results from a 3-nucleotide deletion in DNA, which is transcribed to a shortened RNA strand and then translated to a shortened protein, which ultimately causes disease. Researchers call this protein CFTR, short for cystic fibrosis transmembrane conductance regulator. It's expressed in the mucosal epithelium of the lungs. Normally, CFTR allows chloride ions to flow out of the cell. This is followed by sodium and water, keeping the mucus layer hydrated. In CF, mutations in the protein can lead to not enough chloride leaving the cell, which pulls water back in from the mucus. Now the mucosal layer is dry and sticky, which can plug up patients' airways and lead to infection. To treat this disease, researchers have been expanding on CFTR modulator therapies such as Symdeko.
Symdeko actually goes after the root cause of cystic fibrosis instead of just targeting the symptoms. It's a combination of 2 drugs, ivacaftor and tezacaftor. Ivacaftor is what we call a potentiator. Basically, a mutation in CFTR proteins can affect the amount of time the channel stays open. Ivacaftor mediates this by binding to the channel and allowing it to stay open for longer. When the channels are open, chloride ions can move out of the cell and water follows by osmosis. Tezacaftor, on the other hand, is what's known as a corrector. Its job is to help fix the structural misfoldings of mutated CFTR proteins, making it possible for more of them to actually reach the surface of the cell and then carry out their role as chloride ion channels. So when you put the 2 together in Symdeko, you get the best of both worlds. More CFTR channels making it to the surface and those channels staying open longer. This results in better movement of chloride and water, which improves breathing and reduces the thick mucus buildup that causes so many problems in cystic fibrosis patients.
In 1998, a company called Vertex Pharmaceuticals started its CF research program in collaboration with the Cystic Fibrosis Foundation. In 2017, Vertex announced that its applications for drug review had been accepted by the Food and Drug Administration, or FDA. A few months later, successful Stage 3 clinical trials were published in the New England Journal of Medicine. Symdeko was first approved in the United States by the FDA on February 12th of 2018. Health Canada quickly followed suit by approving Symdeko on June 28th of the same year. The first doses were shipped out to distributors almost immediately after its approval. In 2018, Symdeko was only approved for those aged 12 or older, and since cystic fibrosis is also a chronic and dangerous condition in younger children, expanded approval was needed to treat those under the age of 12. Luckily, the FDA expanded approval of Symdeko for patients as young as 6 years old a year later on June 21, 2019, after some more testing and review. Finally, a third review of Symdeko in 2020 expanded approval for those with 127 other rare mutations in the CFTR gene.
Symdeko's safety and efficacy was evaluated through 2 double-blind Phase 3 clinical trials. Both studies ran for 2 years, where half the patients were given Symdeko and the other half ivacaftor or a placebo. Ivacaftor was well studied as a CFTR therapy and already existed as Calideko in Canada. The purpose of the trials was mainly to assess the effectiveness of tezacaftor and ivacaftor as a combo. The clinical results showed increased lung capacity with fewer respiratory symptoms when compared to ivacaftor alone. These trials were somewhat limited because they featured 0 patients below the age of 12 and very few over the age of 65. So how do we improve Symdeko? The good news is that improvements have already been made with Trikafta, which is now the leading CFTR modulator. It's basically Symdeko with elexacaftor, another protein fold corrector. Generally, improvements to CFTR modulators will be made with the addition of more of these repackaging style medications that target more and more functional mutations and expand the population of people that can benefit from these therapies.
We've transformed the disease into something that used to kill people in young adulthood into something that won't hopefully kill anyone, and people can live a normal lifespan and have a normal life.